Dr. Price, and welcome back to my channel. So I'm in a bit of a different area today. I decided to do this at work during my lunch because this video is going to be about medical simulation. So have you ever wondered how doctors and nurses practice like life-saving procedures before being in a real life situation? They do it through medical simulation. So basically what medical simulation is, it's a safe learning environment to where doctors, nurses, and when I say doctors, I mean resident doctors, or it could be attending physicians. We also have medical students come in often, and they all come in to learn different medical procedures, whether it be suturing, whether it be IV insertion, catheterization, code blue simulations, vast variety of things that you can learn in simulation. So what we're gonna go over today, basically in the video, we're gonna do like a quick couple-minute walkthrough of the simulation center. I had already pre-recorded the video, so I'm just gonna do a voiceover to kind of go through it with you, to show you where the different rooms are in the center. And then I'm gonna, of course, to show you the high fidelity mannequins that we have in the simulation center. Use them for a variety of different things. And then last but not least, I'm gonna show you a couple things that I help to prepare, these different task trainers and what have you, different suture pads, and I also show you how I prepare the IV arms, as well as setting up for a vaginal delivery simulation that we do quite often. Before we get started with the walkthrough and everything, I will let you know that I am currently working as a simulation technician. So, simulation technician is the title of my job, but it's kind of confusing, to be honest, because what I do is not entirely simulation technician responsibilities, because at other facilities and other hospitals and such, simulation technicians do probably way more in-depth things, as far as I understand, than I actually do, because this is a temporary job at this hospital specifically for specifically Ross medical students who have graduated and have not matched yet. It's kind of for like a gap year sort of thing. So that's why this specific position is open for me, being a graduated Ross student. So as a simulation technician, I help with whatever's needed in the sim lab. So as I have done like setups for different simulations, so setting up for like the suture training, I have set up for the vaginal delivery simulation, I have set up the IV arm. I've also been a standardized patient for the incoming first year residents for like internal medicine. What else have I done? So I've also helped develop the curriculum for the medical simulation elective for medical students, which was awesome. And quality improvement projects, I've helped with those. So yeah, I do quite a variety of things here as a simulation technician. If you have any more questions about what I do, you can also ask those in the comments. So without further ado, we're gonna go ahead and get into the video, and I hope y'all enjoy it, and let me know if you have any questions.
Okay, welcome to the Simulation Center. I had to slow down this video a little bit so I can talk y'all through it. But to the right is our nursing station. We don't use it for much, but we've had some people come in to do exams there. Otherwise, we just use it to print. And then next you can see our IV station. I will have a little bit of a video at the end showing you how I set up one of those arms, and there is some of our IV supplies. Next up is our clinical exam rooms. This is what each of our exam rooms pretty much look like to mimic an outpatient clinical exam room. We have 6 rooms, 2 of which are used mostly for storage but look just like this. And here is another example of a clinical exam room that we use for storage. We use this for anesthesiology department to come down and do simulations. The other exam room we actually use to store our laptops in. And here is the main hallway with the rest of the clinical exam rooms. But I'm not going to take you through each one because they all look the same. And at the end of the hallway, we go around the corner to the right, and that will take you to the observation deck. The observation deck is what our instructors and proctors use to kind of watch the simulations going on in the med-surg room, which is this first room here, as well as the ICU room, which is the next room we will see here soon. And these simulations are primarily like ACLS or Code Blue training. And then this back hallway is mainly for storage of like IV poles, the anesthesia machine that you just seen there, as well as hospital beds. Okay, and then around the corner we go. The simulation center is pretty much just a big circle. This is the back door, not much to see here. But then this takes you to the main hallway where we have more hospital beds and mannequins. And I'll take you to the ICU room first. The ICU room is pretty much an identical copy of the ICU rooms on the floors, so that when we do simulations in here, you can kind of get the feel of what that's like, as well as med-surg room, again, is an exact copy of what's on the floors. They have bathrooms and everything. Mainly our nurses use this for like ACLS and different trainings there, as well as ITLS. Back to the main hallway. We're passing some more simulation mannequins. I'll show you those a little bit later. And to the right here, we have an example of one of our locker rooms. Of course, there are many locker rooms in the hospital. This is just kind of an example of one, which is much smaller than the actual locker rooms, or at least most of them in the hospital. Here is an example of our ED bay. This is just the third ED bay because we have two others as well. I didn't get videos of those. This one in particular is used to store SimMom, as well as some ventilation equipment as well. And there's a storage room in the back there. But our ED bays don't look like this anymore in the hospital. This is like the old school ED bays. Back to the main hallway. This is kind of just to show you the front door. Again, not much to see here. And right back to the main hallway. At the end there is the storage room, but I didn't take a video of that either. I thought that was kind of unnecessary. But to the right here is my office, as well as a simulation coordinator. That is where my desk used to be, but it is not there anymore because we have a new simulation coordinator. Yay! So my desk is the one in the back right here, which I know a lot of people are like, oh, but I'm actually happy to be in my little corner. I do not have to greet everybody as they come to the door, so I'm quite happy with my little corner. But back out to the main hallway. This is just where we store the whiteboards. And this room is the main event. This is the simulation lab and classroom, where most of the simulations take place, from suture training to nursing orientation to cricothyroidotomies. Literally everything pretty much takes place in this room. So that's the classroom there. And I will turn around to the bigger side of the room, which is the simulation lab. As you can see, our central line task trainer is there, and I'm showing you some of the other task trainers that we have as well for like endoscopies, whether it be for ultrasounds, you name it. And in this corner over here, we have our Da Vinci machine, which is actually really cool to use. I've used it a few times. If you don't know what a Da Vinci is, you can either Google it or ask me in the comments and I'll let you know. But it's very cool to use for surgery. There was more of our airway mannequins. And then that heads back out into the main hallway. And here we have our FLS station with equipment and FLS boxes. FLS stands for Fundamentals of Laparoscopic Surgery, which is primarily used for the practice of our OB-GYN residents. So yeah, that is the Simulation Center, and I hope y'all enjoyed that tour. I will go ahead on to show you kind of an overview of this big old room, and then we'll get into some more videos on the simulation mannequins and task trainers. Enjoy! So here we have an example of our simulation mannequin, SimMan. I named this one Hogarth. I actually named a few of these. We use him for cold blue simulations. And here's another mannequin. I don't have a name for this one. This next mannequin is Noelle. We use her for vaginal delivery simulations. Next up, we have our third SimMan. This one's name is Cookie. We use this for our ACLS training primarily. And then the following mannequin is SimMan 1. And this one's name is Nigel, also used primarily for ACLS training. This one's name is Charlie. It's a simple lightweight mannequin that's used for all kinds of things for the nurses mostly. And then we have a child mannequin as well. And this is the SimMan Classic. He is the oldest SimMan in the simulation. I think he's a good, at least over 10 years old. And then this one is a Mediman, which is also a very old simulation mannequin. We don't use him very much. And here is a short demonstration of how the vaginal delivery simulation mannequin Noelle works. So she's giving birth to her baby right here. And she does different rotations of the baby as well as a breech delivery. So next up is how our simulation mannequin baby works. Sim Newbie. I'm not going to talk over this part so you can hear what it sounds like. Here is an example of what our vaginal delivery simulation setups look like, where we have Sim Mom and a couple of Sim babies, as well as some lubricant, umbilical cords, and placentas. So here I show you how we set up for one of our simulations for general surgery residents. They go through many different simulations, of course, but this one in particular was just a setup for practicing biopsy of a mass in breast tissue. To do this, we take some boneless, skinless chicken breasts and make a small incision in the breast to kind of create a small cavity to place a green olive inside. Each breast gets about 2 to 3 olives placed inside. So do you remember the FLS boxes I showed you earlier in the simulation lab? This is what we use these FLS circles for, which is basically gauze with black ink circles pressed onto them that the OB-GYN residents use for laparoscopic surgery practice. And here I am showing you how we create a chest tube task trainer. We use basically a slab of pork ribs and we place them onto a trash can that has a hole cut into the side, and we basically just wrap it with a bunch of gauze and ace bandages to kind of simulate skin. This way the emergency medicine doctors can come in and feel for the ribs and place a chest tube. Here are just a few pictures on the process of how we make our suture pads. If you follow me on Instagram, you've already seen this on my story. But we mixed some silicone with a few different colors and we pour it in layers to get the epidermis, the dermis layer, and the subcutaneous fat layer.
Just so y'all can see what it looks like when the suture pads are finished. That side is sticky, so that's what it looks like. So it's got a dermis, an epidermis, and then a subcutaneous fat layer. This side is super sticky. But this is what we do with them afterwards. This is the old one, so same thing, but you just cut them into little rectangles and then you make slits in them so that you can use them to suture, practice suturing and closing wounds. Yeah, so that's what we were making yesterday.
And last but not least, here I show you how I prepare our IV arms. These arms we use to practice placing IVs into patients' arms. So here I am placing some simulated blood into the IV bags. So the blood basically goes from one IV bag through the arm into the second IV bag. I wanted both of the IV bags to be halfway full, so here I am adding some more simulated blood to the bottle. That bottle did say arterial blood, however, that is not what arterial blood looked like, so I was a tad confused there. Because arterial blood should be a bright red and not dark like that. That's more like venous blood, but I just went with it anyways. So here I'm mixing the other blood into the bags. Makes it look a little bit more realistic, I suppose. So now I'm just using the power of gravity to get the blood to even out between the bags. And then I just clamp both IV lines so that the blood is no longer running through the lines. A little non-verbal demonstration of what I just told you. And here is the IV arm in its full length. We do have two different IV arms, which I'll show you a little bit later. We have, of course, the more melanated IV arm and then the less melanated IV arm. So here I'm just showing you that I'm taping off the more proximal tubing to the arm. This is just so that we can kind of protect it a little bit because these things are really fragile and kind of decompose over time. So to kind of preserve the arm for a little bit longer, we tape them off, trying to prevent the tubing from twisting or from also getting holes poked into them over time, because they will start to leak, as some of our older arms started to do. So here I'm just taping them off. Give you a little close-up of what the taping looks like, and here's what all three of our arms look like at our IV station.
Alrighty, so I hope you guys enjoyed that little spiel, that little tour and everything. Please again, let me know if you have any questions in the comments below about simulation, about my job as a simulation technician, about like different procedures and what have you that we do. I will be happy to answer anything that I know. If it is outside of my realm of knowledge, I will be glad to look it up or just tell you that I do not know. So yeah, make sure you like, comment, and subscribe. Press that little notification bell too so that you know when I upload next time. And come check out my channel every Sunday at 4:44 p.m. I make sure to upload a new video every week, at least until I start residency. So yeah, later loves.